Hello, my name is Elaine Gonzalez. I work with ChildrenFirst Home Healthcare Systems. I've been with the company for the last 17 years as a clinical care coordinator. Once we gather the information from the physician's office referral or one of the social workers at the hospital, we can have one of our nurses go to the hospital and meet the client there to get the initial assessment done, which has to be done by an RN. Once that process takes place, all the documents are sent in to EQ Solutions for a third-party authorization, and once that is done and completed, the child may attend our PPEC as well as getting therapies of PT, OT, and ST.
Hi, I'm Olivia McGrath. I'm a registered nurse with ChildrenFirst. My background is in the pediatric ICU as well as the pediatric emergency room. Basically, I manage the discharge coordination from all the hospital resources that we have: Florida Hospital, Winnie Palmer, Arnold Palmer, as well as Nemours. Me and my team work really closely with the hospital referral sources, such as the social workers and discharge planners, to help get all the physician orders as well as all the clinical documentation we need to get the authorization and discharge coordinated for the clients to go home into a home care setting.
For services that require a group home, a physician's order that states 24-hour nursing care times 7 days a week for 60 days, and for our medical daycare, a prescription would require medical daycare services times 5 days a week for 180 days.
I have a large team of respiratory therapists. With all of their knowledge as well as the clinical nursing knowledge that I have, we coordinate very closely for every client on their unique individual medical needs to ensure that they get the continuity of care, the hospital care they were getting inpatient once they go home. We know how much care you put into them every single day. They are on the NICU unit and in the pediatric ICUs. And we want to make sure that we set them up for success when they get home. That means making sure they have all the services they need, all the clinical documentation we need to get it authorized so the insurance can help pay for some of this. And we just want you to know that once you get these kids home, they're in good care. Whether it be with the private duty nursing, no matter what company they go with, we want to know that they get the durable medical equipment they need, the ancillary supplies that they need for everyday care, and any of the services they need, such as PT, OT, and ST. When we do the home assessment, we evaluate for things such as, do they have electrical outlets in the home that can support something as complex as a ventilator, concentrator, suction machine, pulse ox machine, apnea monitor. All of these pieces of equipment are necessary for a ventilated patient to be cared for in the home. Once we do the home assessment and we evaluate it is safe for discharge, then we schedule with the parents for a complete training inside their home with the equipment that the child will go home with. We do the training in the home on the ventilator, and once our respiratory therapy team, many who have neonatal ICU experience, have signed them off for competency, then we know this is ready for a safe discharge. We make sure that our respiratory team is available at any time. We troubleshoot over the phone. We respond within 2 hours if they're having any issue with their equipment. They're in good hands. And that's something we really understand here at ChildrenFirst, that you put in the time there in the NICUs, and we take care of them after discharge.
I'm Angela Martinico. I prefer to be called Angie. I'm Cecily Martinico's mother, and her father is at work today, but his name is Jerry Martinico. We've been together for 23 years, and we've took on a lot taking care of a special needs child, but it's our life. We enjoy it. We don't keep her from anything, and we've learned a lot.
My name is Cecily Martinico. I'm 21 years old. I have spinal muscular atrophy type 1. I've been vent dependent for most of my life. I've been with ChildrenFirst since I was a baby. ChildrenFirst supplies my nursing and all my medical equipment, including my vent catheter. It comes out monthly to check all my medical equipment. I use this device called a Dynavox to communicate. I'm able to tell my parents or my nurses whenever I feel sick or if there is something wrong with my vent or trach. I use my eyes or this device to communicate with them.
I heard about ChildrenFirst. Cecily was diagnosed at 6 months at Florida Hospital with spinal muscular atrophy. And After she got well, they vent trached her, G-tube. Then they said that she needs provided home nursing, and they brought in Children's First Marie, and she spoke with us and told us about her services and what Cecily needed for the services. And when she got to come home, then the nurses were home. They brought her home by ambulance, and the nurses were waiting for her as we got home. 24-hour nursing was provided by Children's First, and that's where it began, with Cecily getting taken care of by nurses. The nurses were teaching us as I was, learning about her care and needs.
All of our services here at Children First can be requested by physicians, nurses, hospital discharge planners, social workers, and even the parents. To ensure the continuity and the highest quality of care, all of the services provided are professionally coordinated by a team of clinical specialists. We appreciate the effort and dedication put forth by the healthcare professionals and support teams in preparing each of these families for a safe transition home.